Hi, I'm Dr. Dave Lenihan. I am the CEO of Tiber Health Corporation, which is the parent of Ponce Health Sciences University. And with me is
Damian Nwaneri is my name, MD. I teach pathophysiology in Ponce Science University.
all right. So, what the heck is this thing? What are we looking at?
Okay, fine. This is an anatomage for showing the parts of the body. Okay, but today we'll be looking at mainly the kidneys.
Because that's your specialty, right? That's what your
mainly
research
the kidneys,
is on.
Yes, yeah, that's what my research is on. So, the kidneys. Now, the point is why the kidneys are really two important organs. They're located at the retroperitoneal region of the body.
I don't know if they can see that, but what's cool is you can touch the screen and move the body around.
Exactly. So,
and he's highlighting it. I don't know if you can see it, but you highlight the kidneys and you touch it, it highlights it up.
Exactly. So, of course, that's the capsule, but as little as you think it is, it has more than millions of nephrons. And these nephrons, when they are damaged, it's usually difficult to regenerate. And so,
but what's the kidney do? What's the
kidney tend to, of course, regulate electrolytes, they regulate fluid, and of course, they excrete waste products. Okay, so these are the things they do. And when these kidneys are unable to excrete these waste products, there will be a huge problem, of course, such as, of course, which could be an acute problem or could be a chronic problem. Now, other things that can lead to this include diseases, and which is the area we work on, HIV, especially in children.
But your specialty, just real quick, your specialty is pathophysiology, looking at the physiology of disease.
Yeah, physiology of disease.
And so we're going to focus on talking about the kidney and what happens when someone has a disease. How does that affect the kidney and affect what happens when the kidneys are working?
So exactly, like I mentioned earlier on, the problem with the kidneys could either be acute or it could also be chronic. So for the acute ones, this problem could be what we call pre-renal problems, or they are the intrinsic problems, or they could be post-renal. Because when we look at the renal, the kidneys is actually within a system that we call the genitourinary system. Okay, so where the kidneys is the main controller, but it also has its own tubes there that tend to, that the urethra coming out there. And then, of course, moving down through to this place. Sorry, let me just quickly roll that on. There you go. Remember, they are retroperitoneal. And then it goes there and then comes in through, and then there is excreted out through the urethra. So the problems within the kidneys could either be pre-renal, that is before you get to the kidneys. Remember that the kidneys tend to drain all the waste products, or the problem within the kidney itself as a factory. We call it a factory. Or it could be post-renal. That means the product is out of the kidneys and is unable to excrete.
So what would happen if somebody had diabetes, type 2 diabetes? What happens to the kidney?
Exactly. For somebody that has the type 2 diabetes, the kidneys tend to have problems. Remember, there are intrinsic, what we call the extracellular matrix within the cells of the kidneys. Okay, so remember that in diabetes, we talk about glucose, and these excretions are really influenced by electrical charges. So in diabetes, these electrical charges by the glycoproteins are usually impaired, leading to leakages of protein in urine, which we call albuminuria.
Okay? Is that bad for the kidneys?
Yeah, and so because of that, the other products tend to now affect the excretory process in the urine, and of course tend to cause some damages to this extracellular matrix within the kidneys.
So the pushing the protein through causes the damage.
That causes the damage. And of course, that leads over a period of time could lead to what we call diabetic nephropathy. And that's one of the huge problems in diabetes. Other problem that can cause a kind of problem there in the kidneys remains if an individual is also hypertensive. Okay, in this case, we are looking at the efferent arterioles that tend to be constricted due to possible lichen and atherosclerotic problems, and then causing a kind of a huge backlog and pressure within the matrix. That also causes a kind of damage. And then that would also lead to.
So it's kind of like you squeeze a hose, which causes the pressure to be built up,
exactly.
And then you push more fluid through the kidneys.
So that causes also hypertensive nephropathy. So these are the major points in adults. But in children, some few things can happen to the kidneys in children. Simple special diseases like maybe loss of fluid from diarrhea, maybe stomach bug, vomiting, gastroenteritis. They could cause damage to the kidneys in terms of what we call acute kidney injuries or acute kidney failure. Then other intrinsic problems can happen if they have what we call post-streptococcal glomerulonephritis, which is the most common one in children. And then, of course, other ones could be if they have nephrotic syndrome. These are some of the few problems that can cause them the damage to the kidneys. And that's quite a huge problem.
I know one of your specialties is HIV.
Yeah.
So how does HIV affect the kidneys, and what types of things would happen to the kidney in those situations?
Yeah, in the research that we actually did, HIV could affect kidneys in several ways. First of all, it could be as a result of the immune response itself. Then it could be as a result of opportunistic infections, which of course individuals with HIV are prone to opportunistic infections. Then we also talked about drugs. The individual is in terms of multiple drugs and can be on drugs for a very long time. They are also contributors of damages to the kidney. And of course, one of the major important problems there is immune response. Then finally, we talk about, especially in Black children, what we call the APO genes in them, which is being investigated recently, as a major contributor to kidney injuries, especially the tubular kidney injuries. Okay, because in the kidney we have the tubules, of course, we have the glomerulus. So these are the key factors that we could look at.
I was a medical student. Mm-hmm. Renal physiology was the most difficult course there was.
Exactly.
Why is renal physiology so difficult? Why does the student find renal difficult?
Well,
the study of the kidneys. Why is the study of the kidneys and the GI system like that? Why is that so difficult for a student?
Well, I would really want to say that is one of the things I want to mention here is, I think it's more or less personal. Because for me, I found renal physiology more interesting than even
really?
Really, because most times I keep telling some medical students when you see because when I see renal cases in possible clinical scenario or even an exam, I will feel like, oh, I think I'm at home really, because we talk about fluid loss and we talk about electrolyte loss and we talk about how can we maintain fluid and electrolyte homeostasis, and you fix it. That's one of the reasons why I feel this for me is a little bit more.
It's a logical organ.
Yeah,
it's a lot. Like I teach the thalamus. That's really complicated. I found the kidney very difficult, to be honest. So I guess everyone finds their own balance, so to speak, on the kidney.
I think so. That's just the point there. I really think that the difference is just there. So,
do the students like using these type of tools?
Yeah, they do. They do, because if you look at this tool helps you to look at the different parts of the body, okay, and the structural part. And the point that it gives you a 3D image of the body. You look at the kidneys, and then you can rotate it, okay. The way it is, of course, you can look at either the bone structure.
You can really rotate it.
Exactly, you can really rotate that. Okay, and then you can also give you the anatomical structure, the organ, the internal organs. It can give you the nerves. It can also give the bones and all that. So it's actually something very useful for.
I like it because it can show you. It can show you the relative relationship to the kidneys, to the liver, and the stomach, and the intestines there.
And one of the things we really want to say here is that the kidneys, being so important, is also connected to the heart and of course to the lungs. So it becomes a kind of a triple organ. But the fortunate thing here is that when these other two organs, the lungs and the heart, which of course is the cardiovascular system, have any problem, the kidney suffers most. That's what we call the diving sea reflex. If there's any kind of blood shortage anywhere, one of the things I will do is that the kidneys will shut down, okay, in order to ensure that the heart and of course the brain receives blood. Okay, so because we know that if the heart goes, every other thing shut down. If the brain goes, every other thing shut down. So the kidney actually sacrifices itself, okay, to maintain this kind of homeostasis in acute or even in some certain level chronic-ish, situations. And of course, the kidney has a lot of ways by which it can maintain that.
Yeah. So I know that when I had heart surgery, so I had heart bypass surgery. One of the things they were really worried about was the kidney function the day after the surgery and for the next week. So they're doing that to make sure that the fluid balance, that relationship between the heart and the kidney is intact.
Is intact, exactly. Because if that doesn't really happen, it becomes an issue. Remember that I said when the heart has problems, the kidney has to sacrifice itself to maintain fluid homeostasis to the heart. But that shouldn't last for too long.
Right.
Because if it does, some of these nephrons will start going down, some of them will start dying, and it may be difficult to regenerate. In as much as it's making such sacrifices, yet it still has to say, look, I'm here, you need to protect me. And so the heart, you have to start getting on, and then things begin to normalize. The same way, if anybody has heart failure, for example, from any cause, the kidneys also want to shut down a little bit. Well, I use the word shut down, but we actually call it a kind of a diving seal reflex, kind of a reflex within the body to divert fluid, divert blood, plasma, and other things to main vital organs, such as the heart, the brain, and the lungs, but at the same time trying to play down on the kidneys because they know that the kidneys can readjust itself using the juxtaglomerular apparatus and, of course, the renin angiotensin aldosterone I mentioned earlier on, which tend to maintain the balance to the kidneys, as well as maintaining the homeostasis to the kidneys, blood supply to the kidneys, and preserve the kidneys until the insult is over. And of course, as soon as the insult is over, the kidney also bounces back and begins to go on its own journey. However, if it doesn't really happen the way it's supposed to be, the kidney then begins to shut down fully, and there may be a serious problem.
Right. Well, this is why it's so exciting in medical school. You learn all these different things. And some people find some things fun, renal, and some people don't.
Exactly.
So you were at the Ponce Research Institute. The Ponce Research Institute is the nonprofit arm that does research for Ponce Health Sciences University. And we had a big conference down in Puerto Rico, and you won an award.
Yeah.
It was for an oral presentation. What was your research on, and what did you win the award in?
Exactly. So we looked at, again, we just talked about the kidneys. So we looked at the validation of some few biomarkers that can help us to detect early kidney injuries in children living with HIV. So there are several biomarkers that could be used to detect early kidney problems. Remember that I mentioned earlier on that when there's an insult either to the heart, especially to the heart, the kidneys tend to conserve itself so as to maintain blood supply and homeostasis to vital organs. But this shouldn't last for too long. And of course, in individuals, especially children living with HIV, which we have mentioned, there are several things that could cause injury to the kidneys, and early detection is very important. So some biomarkers tend to be useful. Okay, in other words, there are some biomarkers you could see in the blood, and you don't see them in urine. But once you start seeing them in urine, it means that there's a kind of kidney issues. And these biomarkers include alpha-1 microglobulin, beta-2 microglobulin. We also look at neutrophil gelatinous associated lipocalin. And of course, the other one is what we call NAG, N-acetyl glucosaminidase. These four
one second. We're going to ask you guys that later, exactly what those were.
Yeah.
Okay. So hope you paid attention. Go ahead.
So those four biomarkers are really important in detecting early kidney injury. However, one is usually more superior to the other. For example, NGA, which is the neutrophil gelatinous associated lipocalin, is usually very useful in acute, usually early detect. They usually secrete early. Any early insult, they usually secrete it. But the alpha-1 microglobulin, which is where we concentrated, is usually good in chronic diseases and is also unaffected by changes in pH of the blood or the urine. So that remains very important. But in sub-Saharan Africa, such instruments are usually unavailable. They usually rely more on serum creatinine, but we know the serum creatinine has its own limitation. Even before you could see an elevated creatinine, more damages had already been done. Right. So we started looking for other biomarkers that are very sensitive. And paucity of work has been done. So what we did was to recruit some children that has HIV, and then we did a spot urine sampling for them using AIM, which is the alpha-1 microglobulin. Of course, we also checked their creatinine, and then we looked at the AIM creatinine ratio. And we actually found out that this biomarker was able to detect, we have a cutoff value of 26.6 nanogram per gram, and its sensitivity was 100%, and specificity was 83.3%.
So you sampled children in Africa
Yes.
who had HIV,
Who had HIV.
and you found that these biomarkers were elevated.
Elevated in them. Exactly.
And that is indicative of kidney damage.
Early kidney damage. And one thing there is that we followed this channel for 3 months, and we also placed them again. We also repeated those biomarkers and realized that there was actually kind of a progressive increase, in the biomarkers we detected in urine. That means that over a period of time, if these children are not really detected early for possible preventive renal medicine or renal medical intervention, they could have severe renal damage.
So I think that's the key thing in the research that we're doing at PRI is that in this particular case, we're able to identify damage to kidneys in children with HIV in Africa or anywhere, and be able to step in at an early stage to help reduce damage in adulthood.
To the kidney. Exactly. That's what we found. And it was really interesting.
Yeah. I think I see why you won.
That is it.
All right. Thanks, Damian.
Thank you very much.